And TB was also discussed this week in Washington. Several leading African researchers spoke on Capitol Hill about their ongoing efforts to develop new TB vaccines. Joining us is Dr. Videlis Nduba. He is a leading TB vaccine researcher with the Kenya Medical Research Institute. Dr. Nduba, welcome to the program.
Thank you very much.
Well, HIV/AIDS has made TB more prevalent and difficult to prevent and treat. Tell us about what you're seeing on the ground in terms of infections and treatment.
HIV is a big killer in our country, especially in Kenya, with an estimated national prevalence of 7%. But I work in Western Kenya, where HIV and TB are the biggest problems in our country. As I told you, there's a national average of 7%, but in Western Kenya, it's about 15%. And when you look at TB patients being enrolled into the national TB program, about 75% of them in Western Kenya are also HIV co-infected. And we think latent TB is the biggest driver of this TB problem. As you know, a third of the people globally are estimated to be infected with latent TB. What that means is they have the TB bacteria in their lungs but don't have TB disease. When the immune system becomes weakened by HIV, then they reactivate and develop TB disease. And we think this is the biggest driver of the TB-HIV co-epidemics.
Now, you are working on a possibly new vaccine that is supposed to be released. We don't know when. Tell us about this vaccine. Is it going to help HIV patients not develop TB? What is it about this new vaccine that will make it different from the BCG?
One thing I want to point out is that there are several leading candidates, very promising candidates in the vaccine pipeline. Some of them are quite advanced and going to phase 2B trials, and Western Kenya will be participating in one sometime in the middle of next year. The thing about BCG is that it's over 90 years old. That's the current vaccine that is used for vaccination. And TB disease the bug is several million years old, and so has learned how to evade the human immune system. So the new vaccine candidates that are being developed, people have better understanding of how the human immunity interacts with tuberculosis. And so some of these vaccines are very well targeted towards components of the immune system that would better be positioned to protect us against TB. And so we are hopeful as these vaccine candidates move through the pipeline, they'll be more protective. In regard to HIV-infected adults, a new vaccine must be safe in infants, safe in HIV-infected adults, and also people with latent tuberculosis. So we are hopeful that these vaccines will be able to protect all those categories of individuals.
Well, Dr. Nduba, that's all the time we have for today. Thank you so much for joining us. And that's your health report. Vincent and Alexa, back to you.
Great. Thanks, Linord. Thanks for joining us today. And remember, you can watch Linord Moudou every Tuesday and Thursday for the latest health news in Africa right here on In Focus.